That's why I'm so excited today to have with us. She is a professor. She is from A&M. She is a forensic nurse. And I don't want to mess this up because she has one of the most powerful reasons why she does the work she does. She's a clinical assistant professor at Texas A&M. Nobody here from A&M? I didn't hear it. Okay. I was like, come on. I know y'all are out there. She is at the College of Nursing in Bryan, Texas. She's completed over 1,200 examinations of children, adults, and suspects suspected of child abuse, sexual assault, or neglect. She's seen and cared for the treatment of over 15,000 patients who are suspected of being abused. She's also served as a preceptor, mentor of over 300 SANE students from North America. Now, SANE, S-A-N-E, it's kind of like FOSTA and SESTA, another one of those acronyms. It's the Sexual Assault Nurse Examiner. She's a frequent lecturer on child abuse, neglect, sexual assault, and impact victimization. But here's the real deal. She does this, and she's so vocal about fighting for these children and identifying where they are because of a child named Zena. They missed her the first time, but she became informed and equipped. And when the second time came around, which rarely happens, for this child named Zena to be saved, I want you to know that our guest with us today, Lori Charles, helped to save her life. I want you to hear more from her now.
So that I can go out and teach people to understand these kinds of things. So we're going to talk about the medical response to human trafficking. So the statistics, we already talked about those. They're pretty significant. They're absolutely terrifying. It is impossible to estimate what the stats are of children that are in the sex industry. But the scary things are teenagers in the United States, teenagers anywhere in the world who run away are at very, very high risk for being trafficked. So I ask children, because I'm a nurse first, I'm a forensic nurse second. So I'm always going to ask from a medical point of view these questions, because if children run away, they are at high risk. And that is important to me medically as a nurse. And do you think kids are going to talk to me? Do you think they're going to tell me these things? Yes? No?
Yeah.
Guess who is the most trusted profession? I'm smiling at law enforcement. It's nurses. It's nurses. Every single year, except post 9/11, firefighters, first responders, they got that year. They deserve that year. But no more. No more. Kids are going to talk to me, hopefully. I've absolutely come across kids that don't talk to me. I've come across kids that cuss at me. I find that as a distinct challenge because I know a couple cuss words. And so I'm always up for knowing new ones. And so I'm like, ooh, bring it. What do you got? No. I want to bond with that child so I can make sure that the two of us together are making the best decisions for that child's health and welfare. And so if I can get them to talk to me, then I can make them safe and healthy. So I'm going to ask questions like, are they running away? The terrifying numbers about how many cases were called into the hotline, to the National Human Trafficking Hotline. If you're ever concerned about human trafficking, call it into the hotline. 20% of United States human trafficking occurs in Texas. I'm from San Antonio. I'm from Canada. Really? Woo! Canadians are awesome. And then I moved to San Antonio and I was there for 1,000 years. While I was in San Antonio, I don't know if you guys know, but 35 and 10 intersect in San Antonio, right? What that is a massive human trafficking hub. What is Houston? One of the biggest ports in the world. Hub for international trafficking. In San Antonio, what we were seeing was domestic minor sex trafficking. So trafficking of children all over, but definitely those kids are coming through San Antonio. They're definitely in Houston too. This research by Lederer and Wetzel in 2014 is absolutely terrifying, but I think it's important to understand. They interviewed people who were trafficked, so they have survived being trafficked. When they asked, was there violence? Look at those numbers. 81% experienced forceful sexual acts. 68% experienced forceful, unprotected sexual acts. So not only are they using force, fraud, or coercion, they're also putting them at significant risk for pregnancy and sexually transmitted infections. And some of the sexually transmitted infections, HIV, hepatitis, can absolutely cause death. Gonorrhea and chlamydia, which people are like, no big deal, give antibiotics. However, if a person has gonorrhea or chlamydia for a long period of time, it can cause sterility, right? So a child who is sexually assaulted at the age of 13 and is terrified to tell her parents, she could have gonorrhea or chlamydia, and by the time I find out 2 months later, she's sterile and not able to have children now because she's too scared to tell of what happened. So these things have significant health impacts. So me as a nurse, I need to know all those things and I need to ask those questions. 68.9% were beaten, 66% were threatened with a weapon, and 54% were strangled. Strangulation is a life-threatening event that causes significant damage to the brain that we may never know. So we have to ask the questions. So the questions I ask are, did anything happen to your neck? And they'll go, yes, forgot all about that. They will not tell if they are not asked. So ask those tough questions. Was there substance abuse? Kelly spoke of this earlier. Look at that, 84%. So was there substance abuse? The answer is just yes. Assume that drugs and alcohol are used. This is the one that terrifies me the most. Again, Lederer and Wetzel in 2014, they asked survivors of sex trafficking, did you at any point in time while you're being trafficked come in contact with a healthcare professional? I was sick reading that statistic. So when 87.8% of the trafficking victims, and I'm using that word specifically, they are being victimized at that time, they are interacting with healthcare professionals. Where are we as healthcare professionals if we're not asking these questions? Because my odds are really, really good that I've come across a traffic victim and I missed it because I didn't ask the question. And in my experience, if I ask the question, I'll get an answer. And you know what survivors have told me? When I say, what did I need to do to allow you to feel safe and comfortable enough to tell me what happened? And you know what they said? Ask how you are. Are you okay? Whew, I spent a lot of time and energy and money on my education. And that, you do not have to be intelligent to ask another human being that question. Are you okay? And not just are you okay and run off. Are you okay and I actually care to hear the answer. And I want to know that you're safe and you're healthy. So if you ask that question, they'll tell you. So we are seeing them in the emergency department for all kinds of injuries. We are seeing them in Planned Parenthood and STD clinics. Regardless of what you think of Planned Parenthood, it doesn't matter. They are there for STD treatment. Sexually transmitted infection. I'm sorry, I'm using acronyms. In sexually transmitted infection or sexually transmitted disease clinics, they need to be asking these questions. A perpetrator in San Antonio that was found guilty of trafficking, whoop, good job. He took his stable of girls into the STD clinic on a weekly basis. For a long time, nobody reported. We need to do a better job. So healthcare professionals are absolutely in a unique position to identify and then help intervene. How am I going to help intervene? I'm going to call the police, right? I'm going to make sure that that person is safe. I'm going to make sure I'm safe, and then I'm going to report. So the impact of human trafficking is very similar to interpersonal violence, but I think it's at a much higher degree. The significant compound trauma that occurs because of human trafficking. I had one patient tell me one time, it's a trauma to your soul that never heals. I had to take a couple minutes, right? Because I think that's exactly what it was. Force, fraud, or coercion, Kelly spoke of those earlier. We need to ask all those questions to make sure that they're okay, that their body is okay. Coercion, they'll threaten victims. They'll threaten the person they're trafficking. They will threaten pets. They will threaten friends. And what I see happen is the victim doesn't want the abuse to continue, but they're terrified it's going to happen to somebody else. And so I'm not saying they go along. I'm saying they don't have a choice. They don't view that they have a choice. We've had several cases where patients were exploited by photographs, and then they said, look what kind of person you are, and they called them nasty names, and they said, we will release these photographs of you if you don't continue to do what we want. They will control access to food, and they will also use sleep deprivation. When the patients come in to me, they're almost always starving, and they're almost always really, really tired. Can they tell me about every single thing that's happened to them in the last however long they've been gone if they're starving and they're tired? No. I'm going to take care of that. Do you need something to eat? I'm going to say, did something happen to your mouth in the last 4 hours? Because if something did, if there was penetration of their mouth within the last 4 hours, then I'm going to collect evidence. But then I'm going to say, let's go eat. So go to the cafeteria, get them some food, and you can see whether or not they need sleep or not. And then we can take care of all the other things, okay? So we have to be cognizant of that. There can be all kinds of fallout from being sexually assaulted, especially PTSD, but the main one we talk about a lot is trauma bonds. That is, we used to call it Stockholm Syndrome, if you're as old as I am. And it is that positive, negative reinforcement by the perpetrator. And they will use force, fraud, or coercion, threats, beat downs, horrible trauma, and then look what you made me do to you. I had to do that because of your behavior. And then that survivor of trafficking starts thinking, I'm so lucky that they're letting me live. And it's that negative trauma bond. You know how hard it is to break a trauma bond like that? It's very difficult. We need to be cognizant of it as healthcare professionals, know they're there, and not be judgmental that they're there. We're going to recognize trafficking exists, I'm hoping. We first need to protect ourselves. That's a little hard for nurses because we like protecting everybody else first. We need to protect ourselves and protect the patients. And that actually works in a positive way for me because I'll like, do I need to be worried about myself? And because they're not worried about themselves, or they don't feel it's okay to be worried about themselves, they're like, well, you know, he's outside. Okay, let's protect ourselves then. And we get in as a group to take care of it. We're going to make sure their health needs are addressed. Oftentimes, if children are on the run, they have not had the health care that they need. They haven't had the vitamins they need. If they have a requirement of making X number of dollars a day, you know, you have to get $1,000 before you get $5 to eat. Do you know what kind of food you get for $5? Is it nutritious? Not really. The salads are way more than $5. So we need to make sure that their healthcare needs are addressed. And then we offer forensic services. What I mean by forensic services is evidence collection, like a sexual assault evidence collection kit. We can collect those up to several days out. You guys in the community, don't worry about that. Get them into the hospital. We'll worry about that in the hospital. The experts will know what to do to take care of the patient. Treat any medical conditions, which include sexually transmitted infections, pregnancy or pregnancy prophylaxis. All healthcare professionals should provide pregnancy prophylaxis if the patient wants that. It does not matter what kind of healthcare professional organization they're part of. I was part of a Catholic healthcare program for 1,000,000 years, and we gave Plan B, and it was okay to do that. It's part of the Catholic healthcare doctrines, we can do that. We want to address any problems that they have. We want to treat emergent emotional and psychological issues. I asked one girl one time, if I send you home, are you going to hurt yourself? She said, 50-50. That's 50% too much. You're staying with me. Refer them to the social worker, the Rape Crisis Center, adult or child protective services, depending on what's going on, and assess for other victims. Is there anybody else I need to know about? And they'll talk about their friend, they'll talk about their sister. Signs and symptoms, we talked a lot about these, but in the healthcare arena, when others speak for the patient, that always stresses me out. I want to know from the patient what's going on with them. And as a nurse, I can get anybody alone, right? Because everybody knows you can't go to x-ray, right? The family stays downstairs and the patient goes up. Guess what I'm doing in x-ray? Talking to the patient. I can get patients into the bathroom and I'll talk to them in the bathroom. Doesn't matter. Kids, I can get kids stickers at the nurse's station. And I can separate them from their family or whoever is there with them to ask them questions. Are you okay? Do I need to be worried about you? If we see brands or tattoos, I always say, wow, that's interesting. Can you tell me more about that? Because we'll see roosters, crowns. We actually had a girl who had her index finger tattoo laid and paid. Did you want that? She's like, not really. Stunning. And the story is exactly what you talked about. Every body part that was open, there was her pimp's name, so everybody knew. If they describe sex with multiple partners over a short course of time, that is almost always an indicator of trafficking. And that is where we missed Zena. Because we asked that question, and she told us she had had sex with 2 adults. Every body part that you could have sexual acts with, she did, with these 2 actors. And we just thought, that's a sad story. We gave her all the care she needed, sent her on her merry way. These ones, teenagers almost always have fearful or aggressive demeanor, right? They kind of rotate between the 2. We need to know where they are. Is this normal growth and development attitude? Or is something different going on? Traffickers might be threatening the survivors, or they might have coached them. This is what you need to say. So we need to be careful and we need to ask questions. Is everything you telling me the truth? Did I miss anything? I read back what they told me. Did I miss it? And they go, well, you know, when I said that, I really meant that. That's okay. Thanks for telling me. There's only one chance to identify a victim and take action, so we have to do it. So I'm going to build rapport with the patients, I'm going to talk to them alone, and I'm going to specifically ask about my safety and their safety. I don't use the word victim, I don't use the word traffic. You have to be aware of street lingo. Sister wives, they call each other, they talk about their bottom, they talk about their mom, and it may or may not be really their mom who is trafficking them. We need to ask those questions and assume that patients might not be able to tell you everything. Have you ever been in a car accident and then your friend asks you to say what happened and you can't really tell them well? That is trauma affecting your brain and causing the fire in your brain. Think from a child's point of view who has been trafficked. How are they supposed to sit and tell you what happened to them? They might be all over the place. It might take them a while to tell you what's going on. And then call the experts, right? There are 2 amazing forensic nursing teams in Houston. There's a Harris County Hospital District has a forensic nursing program. Memorial Hermann has a forensic nursing program, and there's a hospital here in Katy too, at Methodist, I believe, that have forensic nurses. If you have questions, call them. There's the Human Trafficking Resource Center telephone number. Common thread actually our human trafficking advocacy program, and what they do is they build positive trauma bonds with survivors of human trafficking. We've been using them in San Antonio, and they're doing pretty fantastic work. This is my favorite quote of all time. I'm going to close with that. Unless someone like you cares a whole awful lot, nothing is going to get better. It's just not. So if we don't ask the questions of people that have been trafficked, they won't tell us what's going on in their lives.